The point really is we want, this whole idea here is to have a transformative contribution to good healthcare system in this country and in the region. All right, so let's go and see the Women's Health Pavilion. It's just a tour, and as you can see, it's being built at the moment. It's far from being ready, but it can be ready at least partly very soon, meaning within half a year or so. This is going to be the emergency room, and it's quite huge. But this will not be the primary focus of this building. The building is called Women's Health Pavilion, meaning we do especially obstetrics and gynecology, but also surgery. This is going to be the X-ray department, and ICU will be here. What you see here is the theater block, or OR, operation rooms, are all here. There are 4. And at this side is obstetrics. The idea here is to have an entrance here. As you can see, there's still some work to be done to allow for patients to enter here. So pregnant women, women who think they are in labor, will come here and then into this big space and go into this room to triage them, meaning to see them, determine whether or not they are in labor, and if they are in labor, they will be referred to the labor room, which I will show you in a minute. If they are not in labor, they will be sent home or go to the expecting mother's home, which is just down the hill here, very close by. Or if we are not sure, we keep them here and monitor them for some time to decide whether or not they should stay. If they have a condition that requires admission, but they are not in labor, they will go to this ward over here. Let's go there inside, have a look at it. So this is the antenatal ward, meaning the ward before delivery. So this is huge with a big window looking out at the lake. So this is the room where women are who have a condition that requires them to be admitted, for example, preeclampsia or any other conditions in pregnancy that requires admission. If delivery is about to happen, they go this way into the labor room. And what is unique about this place is that you can see it's a big area where the health workers are, the nurses, the midwives, the doctors. And then you have here single private delivery rooms for each patient. Let's go into one of them. And the woman can be here, expecting mother, with her husband or whoever she wants to be with, her sister, her mother, whoever. And she again has this beautiful view, which is really incredible. And today the weather it's a bit hazy, but you can see DRC there and the Lake Tanganyika. It's just really $1 million view. And so this view, we all feel, is also therapeutic and soothing. And the idea really is to come in here when you are in active labor and deliver the baby. Even if she needs operative vaginal delivery, like a vacuum, a ventouse, or forceps delivery, we can do that here. And then the primary inspection of the baby will also happen here, and she can have the baby straight away. The idea really is that women are their own boss, so to speak. She is here, she determines what's going to happen. She has her husband or, as I said, her companion with her, who will also help her to feel in charge. Even if she is worried or maybe is in pain or something, she will have her own advocate who will be there to protect her and to be with her. And I think it changes the whole power dynamic that is so prevalent in this country, in this area, in the world, where mothers are in big rooms together with other people, all alone, without any confidant, and really in loneliness deliver their babies with all the worries that come with it. Even if you're an experienced mother, you're always worried. so you need somebody who is with you. And that's the idea of this room. And we have many of them, and they are all configured in such a way that a little bit a circle, so from the nursing station you can see all of them. Big windows, and the doors also will have big windows in them, so that everyone can see them, but they cannot see each other, and that's why the husband, for instance, can be here, which is wonderful. And if, of course, when the time of delivery comes, a curtain will close, so no problem. If now something goes wrong, or there's an emergency, or we need to do a cesarean section, then the mother can come quickly through this corridor into the theater block. And the first theater is right here, so it's very, very close. So this is the theater where we will do the obstetric operations, meaning basically cesarean section, or if something else needs to be done. So it's very close, it's very safe. So if any emergency, the mother can come immediately. And one indication for cesarean section is fetal distress, which means the baby needs to come out now, as we say in Africa. The point is this: if during delivery a baby is deprived of oxygen for 5 minutes, then damage starts, and it can start with minimal brain damage to maximal brain damage or even death. So it's the most acute specialty there is. 5 minutes, the baby has to come out. Sometimes that's the situation, so this is the reason why it's so important to be very close. So if we go then this way, this is then towards the postnatal ward, where women will go after delivery, which is basically the same as the antenatal ward. It looks the same, definitely at the moment. So this is where women will be after delivery with their babies. If the babies are not fine or need really to be in neonatal intensive care unit, that will be on this side, and it's being built. Basically here. Here you can see this is going to be pediatrics, but it's a huge space, and there will be also a big room for kangaroo care unit, where especially premature babies, but not only them, have skin-to-skin contact with their mothers, will not be in incubators. Incubators are really dangerous because they need to be cleaned very well, otherwise they incubate bacteria as well. The main reason why an incubator is because of heat, to have enough warmth, but skin to skin of the mother or the father does the same thing. On top of it, if it's the mother, we'll also provide food instantaneously. Of course, if it's the father, we are not as good as mothers. Food is a problem, but for the rest it's the same. And it also increases the bonding between father and child, but also mother or grandmother or sister, whoever. But it's also a monitor. Because if the baby stops breathing, the mother noticed immediately. If it's somewhere in an incubator with a machine and an alarm, depending on how many people we have, how many patients, how many health workers, it might go unnoticed. Many, many babies die like that in these big hospitals. So we will not, hopefully not, experience anything like that. So we will have some incubators for babies who for some reason cannot be cared for in kangaroo care, but that should be the exception, not the rule. So that's the idea of this. On the other side of the theaters is the intensive care unit of the mothers. So you can just go straight through. Let's go there. Just let me show you the ICU. This is going to be the intensive care unit. As you can see, also a huge space where we then can look after women and of course men too who need intensive care. So that's here, just the opposite, just close to the theater, which is here. This is the theater block again. The theaters are on the left-hand side and what the light you see at the end is a delivery room. So you can clearly see the close proximity. If We can do the operation here in theater if the mother needs ICU. So this is really the floor on which all the care takes place. And it's really important to realize these labor rooms, as I've just shown you, are really new. There's only one other hospital I know of in Africa where that's the case. That's in Malawi, where we built a similar thing. And it's really an answer to the totally deprived way of giving birth in the midst of many people whom you don't know, all alone, not being seen as a human being, just as a machine that produces a baby. I don't know how that's possible, but this is how it is, and this is an answer to that. If we take women seriously, if we really care for them, that's the answer, and also their families. And husbands will now have a chance to be there and be involved. Most husbands, most fathers do care for their babies, so here they have a chance to show it. So let's go upstairs. So this is the top floor. In this area, we will still have to build the rooms for the doctors on call, or the people on call. It's not only doctors, also nurses, who have to stay the whole night. They will have rooms here where they can rest, if there's a chance to rest. So this whole block here is basically from that moment, from there onwards, for training and research. So let's go through all these pillars here. It's a bit difficult now to see. This is difficult. Okay, you know what? Let's go on the roof. Down here is the pediatric ward. So if you look at this, there you have the big conference room, and you can imagine now how wonderful the view is from there. So we will have their conferences, professional meetings, all sorts of meetings where we can show what we have been doing, where we can discuss, where we can meet. And here, 2 big rooms for skills lab and research. And it's so important that we understand our work. High quality clinical work is only possible if you think about care, training and learning, and research. All 3 of those things have to be part and parcel of all we do. And that's why, if we think about the soft opening in January, if we cannot finish the whole building, which it doesn't look like that we can do that, means downstairs, the labor room, 1 ward, the postnatal ward, the triage room, which I showed you, 2 theaters, and downstairs in the basement, the sterilization department, and up here, this entire floor, because this is relatively cheap to finish, because you don't need any medical equipment here. It's just desks, chairs, internet access. That's it, really. And we can really also invite then people from abroad, international, well, people from within the country, from the region, and beyond, for example, the US or Europe, to come, do research, do teaching, do learning. And the idea really is everybody teaches, everybody learns, and all has to be informed and integrated into the care that we give. That's the essential thing. So let's go this way. Okay, let's go have an overview from the roof. This is where no patient ever will go. Here. So this is beautiful. If you come here, you can look down and see the roof of labor ward where we have just been. It's down here. And so you can imagine now, maybe even better, the view you have when you are in these different private rooms. And also here, this is the roof of the conference room and the research and the skills lab, and over there will be the rooms for the people on call. And so if you go to the right here, you can see, sure, the conference room is just down here at the end of this building with this magnificent view. I mean, learning cannot get much better than that if you have the right people. And this whole area of the top floor will be also for patients. And we hope to have patients here with more private rooms. And these private rooms are for those people who need a private room. We think then of people who might have an infectious disease that needs to be isolated, but also people who might be dying, or people who just have reasons for that. One of the things you see in obstetrics in the region so often is that women have lost a baby, for example, and then are together with, in the postnatal ward with people who have beautiful babies, and that on its own is torture. So if a woman needs to be here because she might have had a cesarean section and loses the baby and wants to have privacy, that will be possible here also. So it's really important to look at our patients as human beings and not problems or whatever, I mean, like it's usually done. So the idea is a humane hospital for human beings. So as I already said, the soft version is a bit toned down, but if you look at this whole thing and you would look up this way, this is where the existing hospital is. So on the left side you see the blood bank, and behind this greenery is the current hospital, and that will be transformed into outpatient clinic so that we have all the outpatients there, as much as possible diagnostics over there, and then people will come here only for admission and operation. Of course, you can always be defeated by your own success, and we are mindful of that, and we have to make sure that at the one hand side that we do not create a private hospital that's only for the bold and for the beautiful and rich, but that we still serve our community. It's a community-based organization. Village Healthworks is community-based. We have to serve our community, and it's very important to keep doing that. So we must we must make sure that doesn't happen. And on the other hand, of course, it will be very difficult to ask people to go away, to say we are full, but this might have to happen. We are working on policies to think how can we do this best, and how can we do a mix of also, because if we have these private rooms for people who are willing to pay for that, that would be great, then we have some sort of income. But again, we must make a good mix so that we have some private patients, but not only. It will be a challenge. It will be a challenge. And difficult choices have to be made, but we already make difficult choices now. Every day is full of ethical dilemmas that really go to the core of who you are. And we always have this arguments of people saying, don't do this, wouldn't it be better to just do some health centers or something like that, because they shy away from those dilemmas. But we have dilemmas right now. People are dying right now in childbirth. Many people die here for, well, no good reason, really. Preventable deaths. But the fact that we don't see them, then we don't have the dilemma. That is, of course, stupid. No, the dilemma is just there. It's just invisible for many people. And building something like this will have two effects. It will make a contribution, but it also highlights the problem, the scale of the problem. And hopefully it will also inspire other people to do similar things. This is just one contribution. No more, but also no less. My favorite part of the building.
Oh, what are you looking forward to?
Yeah, that's a different thing. I don't know. I think my favorite part really is the delivery rooms. This is where things happen. This is where we can do the real job. But I also love the idea of having a research and training hub here where we have international people as well. Because, research is like good communication, it's like everything else. You need different voices, different people, different perspective, different backgrounds, and all of that together will create something new, and most of the time, not always, but most of the time, something beautiful. And I'm looking forward to that the most. Yeah. Are you coming?
Or you want to say more?
No. I'm done talking. I want to do things. Please.
Okay.
Thanks.